Today we will check the try-in stage. First, we have to check it on the articulator before going to the patient mouth. First, we have to check the cast on the articulator. There should be no damage to the cast. Also, when I close the articulator, the incisal pin should be touching the incisal table. During centric, only hinge movement can be allowed. No lateral movement can be present in the articulator. Then I get the trial denture basis to place it. Before place it, check there is no dots of wax or any spots of wax are present on the upper or lower cast. I place the upper and I place the lower. The trial denture basis should be properly extended to the full depth of the contour. Also, the trial denture base should be smooth and rounded. No fracture or no damage in the trial denture basis. It should be stable over the cast. Both when I close together with proper intercuspal relationship, then I will check the setting. I will start with the setting of the lower, which is more important. First, I have to check then the lower occlusal plane of the lower is below the retromolar pad. The lower teeth is at the crest of the ridge. There is no teeth at the upward inclined plane of the lower cast. When I close the articulator, I have to check that there is cusp to fossa relationship and it is properly interdigitated with each other. Then I open the articulator and I close it slowly to check there is cusp to fossa relationship and there is no interferences is present. Now I check the try-in on the articulator, then I have to go to check it in the patient. We have to check the upper first. I have to check the extension, retention and stability inside the patient mouth. I insert the upper, the same like during jaw relation. To check the retention anterior area, I have to pull the anterior teeth downward. No movement is detected. To check the retention of the buccal surface of this side, I have to apply vertical forces in this side. It does not dislodge. And from the post-dam area, I have to apply slight pressure from the palatal surface of the anterior centrals. No movement is detected. For checking stability, I have to apply alternative forces at the premolar area. No rocking should be detected. Then I have to check the extension by retraction of the lip 45 degree and visualize that it is properly extended at the labial and anterior part. Posteriorly, I will check it digitally and check there is no space is detected in the full depth of the vestibule. By this, I check the upper. Then I have to go and check the lower. Also, I will check retention and stability of it. I place the lower inside the patient mouth. I apply alternative forces. No rocking is detected. Retraction of the lip labially and anterior to checking the extension. It's properly extended full depth. And posteriorly, for retention, I apply normal physiological movement. There is no movement of the trial denture base. For the lingual side, the patient is asked to move his tongue slightly right and left. There is no movement of the trial denture base. By this, I check the upper and I check the lower. I have to check both together to check the vertical dimension. I place the upper in the patient mouth and I mark a mark on the tip of the nose and a mark at the tip of the chin. I get my tongue depressor. I allow the patient to relax. جيب راسنا لقدام يا مصطفى. I ask him to swallow. نبلع رقنا يا مصطفى. I mark 2 dots and this is for the rest position. Then I get the lower. I place the lower in the patient mouth. I guide the patient to close and centric. Then I measure the two distance below the rest by 2 to 4 millimeters. Then I check that the vertical dimension is proper. Then I have to check the centric. I stabilize the upper by 2 fingers and I stabilize the lower by 2 fingers. Ask the patient to retrude his tongue. هنرجع لساننا لورا يا عم الحاج ونقفل بالراحة. And slowly I detect that it got cusp to fossa relationship inside the patient mouth. By this, I check that there is coincidence between centric relation and centric occlusion. Again, I will check it one more. I slightly guide the mandible, slightly, and his close. Cusp to fossa relationship. After this, I have to check something else. It's called uneven bearing. Uneven bearing can be checked by celluloid strips that will be placed between the teeth. نفتحها نقفل. And I pull it between the teeth. It shouldn't be pulled. As you see, I insert it carefully. نقفل جامد. No movement is detected on the other side. نقفل جامد. The same, it cannot be pulled. Also, I can check it by the wax knife, the tip of the wax knife. When the patient is closing, I try to insert the tip of the wax knife between the teeth. No entrance of the wax knife tip. On the other side, there is no movement between the upper and trial denture base is detected, and the wax knife cannot be inserted. Also, I have to check for the upper, the aesthetics and phonetics. For aesthetics, the patient, I look for the patient from a side view to check the support of the upper lip and the vermilion border, and for the nasolabial sulcus. And I see that the patient aesthetics is perfect. Also, we have to check for the lower. After placement of the trial denture base, that the teeth are present in the neutral zone. This is the space between the tongue and the cheek on the other side. By that way, I have checked both upper and lower. Finally, before sending the lab my work, I have to check on the articulator that at the rear area, there is no interference between the upper and lower trial denture bases. In that side, or also on the other side, no interference between the trial denture bases. And also there is no interference between upper and lower cast, between the tuberosity and retromolar pad area. Otherwise, such interference will result in uneven bearing. Thank you.